Oral surgery, common procedures and recovery tips. Oral surgery is a branch of dentistry that focuses on surgical procedures to treat various oral conditions. There are several common procedures in oral surgery, each with its own set of risks and benefits. In this video, we will explore some of the most common oral surgery procedures and provide tips for a smooth recovery. Extraction. One of the most common oral surgery procedures is tooth extraction. This procedure involves the removal of a tooth from its socket in the jawbone. Tooth extraction may be necessary for a variety of reasons, including severe decay, infection, overcrowding, or trauma. During a tooth extraction, the oral surgeon will administer local anesthesia to numb the area around the tooth. In some cases, sedation may also be used to help the patient relax during the procedure. The surgeon will then gently loosen the tooth from its socket and remove it carefully. Recovery from a tooth extraction typically takes a few days. Patients may experience some pain and swelling in the days following the procedure, but these symptoms can be managed with over-the-counter pain medication and ice packs. It is important to follow the surgeon's post-operative instructions to ensure a smooth recovery. Dental implants. Dental implants are another common oral surgery procedure that are used to replace missing teeth. A dental implant is a small titanium screw that is surgically placed into the jawbone, where it will serve as a strong and stable foundation for a replacement tooth. The process of getting a dental implant typically involves multiple appointments over several months. During the first appointment, the oral surgeon will place the implant into the jawbone. The implant will then need time to fuse with the bone in a process called osseointegration. Once the implant has fully healed, a crown or bridge can be attached to the implant to restore the function and appearance of the missing tooth. Recovery from dental implant surgery may involve some discomfort and swelling, but these symptoms are usually manageable with pain medication and proper oral hygiene. It is important to follow the surgeon's instructions for postoperative care to ensure the success of the implant. Wisdom teeth removal. Wisdom teeth, also known as third molars, are the last set of molars to emerge in the back of the mouth. In many cases, wisdom teeth can cause problems such as impaction, crowding, or infection, necessitating their removal through oral surgery. The process of removing wisdom teeth involves a surgical procedure in which the oral surgeon will make an incision in the gum tissue to access the impacted tooth. The tooth may need to be divided into sections for easier removal. After the tooth is extracted, the incision will be stitched closed, and the patient will be given instructions for postoperative care. Recovery from wisdom teeth removal may involve some swelling, pain, and bleeding, which can be managed with pain medication, ice packs, and proper oral hygiene. It is important to follow the surgeon's instructions for eating, drinking, and taking care of the extraction site to prevent infection and promote healing. Other common procedures. In addition to tooth extraction, dental implants, and wisdom teeth removal, there are several other common oral surgery procedures that may be necessary to treat various oral conditions. These procedures include root canal therapy, a procedure to remove infected or damaged pulp from the inner chamber of a tooth. Gum graft surgery, a procedure to restore gum tissue lost due to periodontal disease or trauma. Jaw surgery, a procedure to correct misaligned jaws and improve bite function. Biopsy, a procedure to remove a small piece of tissue for examination to diagnose oral cancer or other conditions. Recovery tips. Regardless of the type of oral surgery procedure, it is important to take good care of yourself during the recovery period to ensure a smooth and successful outcome. Here are some tips to help you recover from oral surgery. Follow the surgeon's postoperative instructions carefully, including taking any prescribed medications as directed. Keep the extraction site clean by gently rinsing with salt water or an antiseptic mouthwash. Avoid smoking and using straws, as these activities can disrupt the healing process and increase the risk of complications. Stick to a soft diet for the first few days after surgery to avoid putting pressure on the surgical site. Use ice packs to reduce swelling and pain in the days following surgery. Avoid strenuous physical activity and rest as much as possible to promote healing. Oral surgery is a specialized branch of dentistry that encompasses a variety of procedures to treat oral conditions such as tooth extraction, dental implants, wisdom teeth removal, and more. While oral surgery procedures may involve some discomfort and downtime, proper postoperative care and attention can help ensure a smooth recovery and successful outcome. If you are considering oral surgery or have been advised to undergo a surgical procedure by your dentist, it is important to discuss your options with a qualified oral surgeon and follow their recommendations for treatment and aftercare. By taking good care of yourself during the recovery period, you can minimize the risk of complications and enjoy a healthy, pain-free smile for years to come.